Unmet needs and stigmatisation of people suffering from long COVID after vaccination. Hi, my name is Fiona Campbell. I wish to thank the organisers for allowing me to have a voice to talk about my experience, what I know, and maybe help educate others. I'm an ex-nurse living with long COVID following vaccination. I'm diagnosed as having post-COVID vaccination syndrome. My symptoms, as with many others, but not all, like me, mirror long COVID symptoms. I'll speak from my personal perspective, and although I will mention several support groups, the presentation I will give is as an independent person. Training in the Royal Victoria Hospital, Belfast in 1981, I met one of my best friends. During the pandemic, she worked in a Nightingale hospital, donning and doffing her protective gear daily. I was well aware of the devastating impact the pandemic and of the number of gravely ill patients. I worked in many fields of nursing, but specialised in anaesthetic nursing, completing my training in St Bartholomew's Hospital, London in 1993. A core part of my training was patient observation and monitoring, pre, during and post-surgery, looking for adverse reactions to drugs or surgery, and knowing when an adverse reaction was occurring was paramount. These are the skills I took to my own event. On the 15th of March 2021, I received a COVID vaccine. On the 15-minute walk homewards, I began to feel unwell. Within an hour of my vaccine, I was in bed. There was no lead in to this event until I suddenly developed flu-like symptoms, muscle weakness to the point I could barely stand, severe headache, an aversion to light, then was physically sick, with pronounced internal tremors like little electric shocks. I had a formal PCR test within a few days. This was negative. Then my GP did bloods which showed I had no markers for either viral or bacterial infections. My bloods were normal, but I was not. She wrote, likely vaccine reaction in my notes. She explained she had received no guidance from the Department of Health regarding adverse reactions to vaccines. She said, you should recover in time. She then wrote to a consultant immunologist in Belfast Health and Social Care Trust for further vaccine guidance regarding my potential second vaccine. The reply was, unfortunately, we have no experience in this area. Unmet need. Fast forward a few months and the tremors, vibrations have spread throughout my whole body. I seem to have lost a lot of my dexterity so that using a computer keyboard has become difficult. I have extreme weakness in my legs and arms. Walking is difficult. I also have pins and needles in my legs and feet, chronic fatigue, dizziness, headaches, unrefreshing sleep, severe nausea, tachycardia, poor cognition, especially post-exertion. My mantra now is, let me lie down and think. And post-exertional malaise, to walk to the post box about 300 metres from my home is now unthinkable. I could not work or self-care in this time. I was alone in bed at home. My employers of 20 years, a local council, were frustrated I could not return to work. My GP explained she did not have a clinical code for vaccine reactions, so could not write vaccine reaction or fatigue following vaccination on my sick line. So instead she wrote fatigue and depression, unmet need. My employer started a disciplinary process after 12 weeks. Desperate to save my job, I took unpaid leave for months before trying to return. I tried 2 times over the next year to return to work, but walking to the office from the car park resulted in me having to lie down. My MP and I wrote to the Health Minister for Northern Ireland explaining my case and requesting guidance on my care pathway. She also asked if I could access the long COVID services, as my symptoms appeared to be the same. The Minister replied, sympathising about my illness and explaining I did not have long COVID, so I could not access the services. Unmet need. My GP applied to the long COVID clinic asking could I access their services as my post-vaccination symptoms mirrored those of long COVID. Again, her request was denied as I did not have long COVID. Unmet need. Eventually, I reached out on social media, a medium I was unfamiliar with. I found long COVID discussion forums and joined several of them. I thought this would be a safe place, but witnessed aggression to anyone who mentioned vaccine-induced illness, so I kept quiet. I joined Twitter, where many doctors and scientists were voicing opinions on long COVID. But again, when vaccine-induced injury was mentioned, I was shut down. stigmatization. A social media breakthrough did come in November 2021 though. I came across an American Facebook group, React 19, a group for vaccine injured, which led me to discovering UKCV, a UK-based support and campaign group founded by Charlotte Critchin. The group is run by other vaccine injured people and is now the largest online support group for COVID-19 vaccine injured and bereaved in the UK and has over 1,500 members. Even though the group had strict rules on not discussing the pros and cons of vaccine, it was warned by Facebook that if we mentioned the word vaccine in posts, that the group would be shut down, as this was seen as misinformation. We then started to use a carrot emoji to depict the vaccine. We were forced to talk in code. Stigmatization. Since then, an Irish support group has been formed, the Irish Vaccine COVID Clan, IVCC, are campaigning for vaccine injured in Ireland and providing support for those affected. In April 2022, with the help of my GP, I self-referred to a National Health Service consultant neurologist in Glasgow as a private patient, as waiting lists in Northern Ireland were so long. Unmet need. My GP wrote a referral letter stating, "This patient has suffered debilitating symptoms of long COVID since the administration of XXX vaccine. This is now 14 months after becoming ill and the first time my GP has written down the cause of my illness. In May 2022, I was finally granted access to a long COVID services and the clinic, but only after catching and rapidly recovering from COVID-19 the previous December. I had to justify my illness time and time again in agonising formal Zoom meetings with my employers, as I didn't have a full diagnosis until June 2022. I spent over a year explaining my debilitating symptoms time and again to stony-faced human resources personnel, occupational health, doctors and managers. I received 21 disciplinary letters, and while my union supported me, they explained they could do nothing to stop my dismissal without a diagnosis. On the 14th of June 2022, 15 months after becoming ill, the consultant neurologist in Glasgow diagnosed me with post-vaccination syndrome. With an official diagnosis, I was finally let off the hook to a degree with my employers after 16 months of wrangling. In March 2023, with the help of my union, I was able to negotiate medical redundancy 2 years after becoming ill. I always thought I would have returned to work. Fast forward to April 2024, I now have the additional diagnosis of ME/CFS. This has opened the doors to ME/CFS support, which I found very beneficial. With more awareness of the condition, I am learning to cope and accept my life as it is now. I've learned to confine myself to my energy envelope, and although still greatly curtailed, I have a new life balance which I'm grateful for. Remembering to listen to the signs of fatigue is the key to my new life. Sometimes I don't hear them and crash. Sometimes they're drowned out by being with others and deciding the crash might be worth it. What would help reduce the stigma and address the unmet needs of those suffering from long COVID following vaccination? Educating medical professionals to allow for a recognised diagnosis, which in turn would reduce the stigma and give access to support. A GP clinical code for vaccine reactions. Swift access to specialists for individuals with suspected vaccine reactions under the National Health Service. Access to National Health Service care, including regular consultations with specialists trained in vaccine reactions. The introduction of a National Health Service vaccine reaction pamphlet for enhanced awareness and support. Increased government funding into research of the condition. A review of the MHRA yellow card reporting system. Vaccine damages payment review to be updated in light of long COVID following vaccination and similar cases. Thank you to UniteToFight for giving me the opportunity to share my story.